Hello guys, how are you? So guys, our today's topic is about the stages of hypertension. So guys, as you already know, we have discussed about the types of hypertension in the previous lecture, that there are many types like systemic, pulmonary, primary, secondary. So all these types will have similar effect on their stages. Like for example, if someone is having hypertension stage 1, it can be anyone, like anyone, secondary or primary, anyone will have any stage of this. Like if someone is having for example, the hypertension stage 1 is 140 blood pressure, so even if it is in secondary or in primary, the stage will be same. Okay, so now let me tell you, the stages of hypertension are classified into three main stages: pre-hypertension, hypertension stage 1, and hypertension stage 2. So what is the hypertension, pre-hypertension? If the systolic blood pressure is like between 120 to 139, and the diastolic is between 80 to 89, then we consider it as pre-hypertension. Like he is not hypertensive right now, but he is getting towards the hypertension, so we classify it as pre-hypertension. And the hypertension stage 1 is between 140 to 159 systolic and 90 to 99 diastolic, so we classify it like that. For example, if one person is having both systolic and diastolic like this, then it is hypertension stage 1. And if someone is having blood pressure above 60 and the systolic above 160 and diastolic above 100, then he is classified as hypertension stage 2. So you guys now understand, hypertension stage 1 is between these values and hypertension stage 2 is between these values, and pre-hypertension is between these values. So for stage 1 and stage 2, we start the drugs therapy, like giving them the drugs. But for the pre-hypertension, we do not give the drugs. We do lifestyle changes management. Like if someone comes to you and his hypertension is 120 to 139, then we will do his lifestyle changes management. And I have already given a lecture about the diagnosis of hypertension, so if you guys haven't watched it, then the link is in the description. So if someone has pre-hypertension, we give him physical activity exercise, like he must do exercise, so his regulation of blood pressure will be normal and thrombosis will not occur. And avoid smoking, because his arteries are, like I explained in this, his arteries are already getting a little bit blocked maybe, so avoiding more blockage, we must avoid his smoking. And decrease cholesterol intake will also prevent the arteriosclerosis, like here. And decreased salt intake will cause less contractility, and less contractility means decreased heart rate. And avoiding the stressful avoiding stressful events, or the stressful event should be avoided or managed, because if he is more stressed, then there will be more secretion of epinephrine, and epinephrine will causes more contractility and increase the heart rate. So the stressful event should be avoided or managed. Avoided is very best if someone can avoid, but it is also written as managed, because sometimes a person cannot avoid the stressful event, but he must have to manage. Like if someone has a wife and he is stressed because of his wife, then he cannot avoid her completely, he have to manage it. Like somehow he will have to manage, he will have to avoid a little, and try to not get stressed on small things like this. And decrease the weight. Decreased weight will cause the decrease of obesity, and decreased weight will cause less capillaries, and less capillaries mean less body fluid, and the blood pressure will come down. And increased fruit and vegetable intake will cause there are many fruit and vegetables which will cause vasodilation, so it is important to increase fruit and vegetable intake. And avoiding junk food is same, like decreasing the cholesterol and decreasing the obesity. And recommending yoga and religious activity will causes the relaxation, and relaxation will cause the release of acetylcholine, and acetylcholine release will causes decrease in the heart rate and dilation of the arterioles. Relaxation causes release of acetylcholine is from the parasympathetic nervous system. So if you haven't watched my video on the parasympathetic nervous system, or if you don't have the concept about parasympathetic nervous system and acetylcholine, then the link is given in the description so you can watch it. So these are the recommendation management of the pre-hypertension. So if for stage 1 and stage 2 we have to do the drug treatment, so I will discuss those drugs in the next lecture. And before that we will talk about the final stage of hypertension. So the final stage is the malignant or accelerated hypertension. The characteristic of this hypertension is that diastolic pressure above 120 mm per mercury, that is very high, not the systolic, diastolic pressure above 120 mm per mercury. If you diagnose someone with above 120 mm pressure diastolic, and third degree retinopathy. Third degree means that his eyes will have inflamed hemorrhages in the retina. You can diagnose it by watching his eyes. His retina will have inflamed hemorrhages. So inflamed hemorrhages in the retina, or third degree retinopathy, and diastolic pressure above 120 mm per mercury is the characteristics of malignant or accelerated hypertension. So we must treat that person immediately, because without treatment what happens? 90% of the patient with malignant hypertension dies within 1 year without treatment. So it is very, very dangerous. And even with perfect treatment, 30% dies within 5 years. So even with perfect treatment, 30% dies within 5 years. So it is very, very dangerous. So you can see hypertension can go up to this level as well. Even after treatment also 30% still dies within 5 years. So it is very, very dangerous. So guys, it is very dangerous. So everyone should measure their blood pressure, and if they are getting pre-hypertension, then they must do these all lifestyle changes to decrease their risk of hypertension. And these are all those that you cannot find anything more than these management. This is the best management of pre-hypertension, so you guys must do this. And it is also for exam purposes also, and M.B.B.S students must do remember these things, and about the malignant hypertension also. So that was all about the stages of hypertension. So thank you guys for watching my videos. So guys, if you haven't subscribed to our channel, then please subscribe our channel and click the bell icon so you can get the latest update of the videos. And if you guys want me to upload a lecture on any other topic, then you guys can comment below in the comment section. Okay guys, bye bye, see you.